again. I thought today we'd have a look at some of the regular treatments you might need to give your dog to help maintain their health. When the greyhound first comes to you from the Greyhound Trust, they will have current vaccination and you should receive the certificate, and they will also have up-to-date flea and worm treatment. And of course, moving forwards, it's up to you to keep that ongoing. Now, for the vaccinations, there are different brands available, and the certificate will show you what the vet last administered to the dog. You'll see some stickers that show DHP, which stands for distemper, hepatitis and parvovirus, and this needs to be given every 3 years. You should also have other stickers showing L2 or L4, and this is the leptospirosis vaccination, which needs to be given every year. Now, you'll need to keep track of the date that the vaccination is due, because it does need to be given on an annual basis, and it needs to be given within 1 to 3 months of the date of expiry. If you allow it to go longer than that, the dog will need to start again with a double dose. So we want to make sure that one stays up to date. You may also see on the vaccination certificate that the dog has received a kennel cough vaccination. This one's slightly different. It lasts for a year, but you don't need to maintain that dose. So if you don't get that done straight away at the end of the year, that's fine. And if you are going to take the dog to a boarding kennels, or you think they're going to be more at risk, you can have that done again whenever you feel it's appropriate. You don't have to do it on an annual basis. An alternative to these is to use what is known as a titer test, where you send off a sample and they will tell you whether the dog is still protected or not. This is because some people are keen not to do the vaccination on an annual basis, and there is some evidence that the vaccination, when it is done annually for a number of years, gives the dog ongoing protection, and it isn't really necessary to do that again until that protection runs down. So a titer test is a way of telling whether the dog needs the vaccination or whether they're protected against the diseases that are covered. So thinking about the parasite treatment, at the kennels we use a treatment that lasts for 3 months, and your homing agreement will tell you when the dog last had a treatment, so you'll know that it's due in 3 months from that date, and I always do them at the start of the month. We use Frontline for fleas, ticks and lice, and this is a pipette which comes in an individual packet. You just open that up, and you snap the end off. I'm not going to do that now. But you snap the end off and then you apply it to the back of the dog's neck, and that will be absorbed into the skin. Of course, the dogs have now gone away and I can't show you. Hello AJ, you're back. So that's for the fleas, lice and ticks. We use a worming tablet for the other aspect of it. This is Easy Max, but it has the same ingredients as Drontal, and the number of tablets that the dog needs depends on the dog's weight. So you do need to make sure that you know the weight of your dog if you're going to buy something over the counter such as that. You can also get all these things from the vet, and they can advise you on which is the best one for your needs. Some products include lungworm, others don't. So you need to think about whether that is a particular risk in your area. And also thinking about fleas and ticks. If you're going to be walking in countryside with long grass in the summer, you're more likely to pick these things up than if you walk, say, in an urban environment on pavements and it's the winter. So you may feel you don't want to do this for the dog all the time. You might want to do it just seasonally, but of course that's for you to discuss with your vet. If the dog has had worming tablets recently, they may pass worms 2 or 3 days after they receive the wormer. That's quite normal, and it does happen when the dogs have been in the kennels. It can happen when dogs have been in a home. It really depends on their opportunity to pick up more worms during the time between one dose and the next. So I wouldn't worry about that too much if it happens, just to let you know that it's possible. So they may pass worms in their stools. They may also vomit worms up. And if this happens, it may be that you need to give an additional dose to deal with the extra burden. If the dog has ongoing diarrhea or they vomit worms, these are signs of a bigger infection. So again, you might want to give an extra dose at this stage, but that's something again you can discuss with your vet. If you don't want to give them wormer on a regular basis, again, you can send off a sample and you can have a worm count done, which will tell you the level of worm infestation, if any, in the dog, and you can then decide whether to give them a treatment based on the results of that test. Ticks are a type of parasitic arachnid, which is the same type of creature as spiders, and they feed on blood. You're most likely to pick them up in the same sort of places as you might get the dog catching fleas, so in long grass, on a country walk, in the warmer months of the year. Ticks can transmit a range of diseases, quite a wide variety of diseases, some of which are quite dangerous. And so if you do get back from a walk and check the dog over and find that they've got a tick or several ticks, then it's important that you remove them safely. If you're not sure what to do or how to do it, you're probably best to go to the vet and let them do it. It's important that the whole tick is removed, including the mouth parts, which you can see here are really quite tiny compared with the rest of the tick. And it's important that you don't squeeze the tick, because if you squeeze it, some of the blood it's sucked out and has got mixed with blood that was in there already, may be regurgitated back into the dog, and that's how it transmits diseases as well. So the safest thing to do is to use a tick twister, and you just slide it on, rotate, and the tick will drop off, and that's the job done safely. So that's it for today. We'll be back again soon with more videos for you. Bye for now.